Hi, it's Dr. Sean Carlson at Simple Orthodontics in Marin County, California, bringing you answers to the most commonly asked questions from parents about orthodontic treatment. And today we're going to answer the question, what is the best time for my child to start orthodontic treatment? And this is a tricky question because it does depend on the problem that your child has. And like so many things in healthcare, each problem is specific to each individual. So your child's orthodontic problem may be nothing like your neighbor's child's orthodontic problem. And that's important to remember because your child and your neighbor's child may have different optimal times to start orthodontic treatment. But here's the important take-home message from this video. It is important to get your child screened early. Now, what does that mean? Usually, by age 7, which is the same age that the American Association of Orthodontists recommends every child be screened, that is the age to start thinking about getting your child an orthodontic screening. Now, what is an orthodontic screening? It typically means a thorough examination by an orthodontist. Now, there's 4 things that the orthodontist is going to be looking for during your child's orthodontic screening. And the first one is crowding. And that means there's not enough room in the jaws for the adult teeth to erupt. Sometimes in a 7-year-old child, that's reflective in how the front teeth have erupted. If you look at your child's front 4 teeth, are they in a perfect alignment? Or is there overlap around those front 4 teeth? Typically, that's an early sign of crowding, and this is something that orthodontists will assess in detail when they look at a 3-dimensional x-ray of your child's unerupted teeth, because we can actually measure how big the jaw is relative to how big the expected teeth are, and we need to make sure that there's enough room for all of the teeth to fit. The second thing that we focus on is eruption. How the teeth erupt make a big difference in how the smile develops. And eruption problems are sometimes the most difficult problems to treat in orthodontics. And eruption problems typically mean that the teeth are erupting off course or they don't have enough room to erupt into their proper position. This can create really big problems later that are incredibly difficult and expensive to fix. If they're addressed early, they're very easily prevented. The third thing your orthodontist is going to look at for your child's orthodontic screening is the bite relationship. Is there a big discrepancy in how the top and bottom teeth relate to each other? In young children, big bite discrepancies are much more easily addressed than in teenagers. And the reason is we have so much growth that we can take advantage of, and the jaws are very pliable. So it's important to address those bite problems early. And the fourth and final thing that your orthodontist is going to look for during your child's orthodontic screening is habits and functional issues. This can include thumb sucking, tongue thrusts, breathing issues, other things that may affect how the jaws and teeth develop. Here at Simple Orthodontics, we strongly recommend early orthodontic screening, and we have treated thousands of patients that would have had very difficult problems had it not been for early identification of one of the things in those 4 areas: crowding, eruption problems, bite issues, and any habits or functional problems. So get your child screened. Again, usually 2nd or 3rd grade is a great time to do it. Feel free to reach out to us here at Simple Orthodontics if you have any questions. Visit our website at simpleortho.com or follow us on YouTube, Instagram, or Facebook for more videos like this. Until next time, be well and smile more.